Well, welcome back, everybody. We are taking your questions now for our veterinarian of the day, David Graff. Thanks for coming in today.
Glad to be here.
Who'd you bring with you today?
This is Oreo. Oreo is a 10-month-old neutered male Pomeranian.
Okay, and we'll be talking more about problems that can affect little dogs like him in just a minute. But first, we have a caller named Roberta on the phone with a question about her cat. Roberta, are you there?
I have a 3.5-year-old female. She's been spayed in about December of this year. My father-in-law passed away, and I've got her and her sister. But she started urinating on the sofa, and I've tried spraying it, cleaning it, and she just continues to do so. What can I do to change that? I mean, we've given her where she's getting more attention and stuff, but she's still doing it.
She's a cat, right?
Yeah. Yeah.
Cats urinating on the rug is probably one of the most common things that I talk about with people with cats. In fact, you'd be the third today. First thing is to have your cats examined and checked by a veterinarian to make sure that there's not a urinary tract infection, because blaming a cat for a behavioral problem, if it's a urinary infection, is wrong, and it doesn't fix the problem. So first of all, make sure that it's not a urinary infection with your veterinarian. And if it is behavioral, there are training methods. The most common training method is extra litter boxes that are kept clean. People don't mean to, but they buy covered litter boxes. They buy litter boxes that have perfumed litter. They don't keep them clean enough, and they don't have enough litter boxes. My rule is to have at least one more litter box than cats. If you have 2 cats, you should have a minimum of 3 litter boxes. Yeah. And then there's medicine that sometimes is used to control this in cats too, if it's a behavioral problem. But the first thing is to have a urinalysis done and an examination done by your veterinarian to see if it's a physical problem.
Yeah. I always had 5. I know, with my cats, always 5 litter boxes, because that's the best way. He just wants to go to his mom, Okay, we do have another caller on the line. Go ahead with your question. Hello, are you there?
Yes.
Okay, go ahead.
Yes, I have a cat that has little things on the bottom of its chin, like little things that stick to the very tip of the bottom of the chin, and wonder if that's something I should try to pull off or leave it alone, or what do you think it is?
I didn't hear that.
Like little things stuck to the bottom of his chin.
Cat or a dog?
Cat.
Is a cat with black stuff on his chin?
On the bottom.
Okay, that's feline acne, probably. They call it that in cats. And what it is, it's an infection of the hair follicles on the chin of cats. It's very common. There's a lot of ways to treat it. Treating it can be treated with astringents that dry it out. It can be treated with corticosteroids. It can be treated with antibacterials. It's very common in cats. It can get very, very bad. My own cat had a really bad case of this once, and it required some aggressive medication. Okay. But it's very common in cats and usually fairly simple to treat.
Okay, and real quick, we have about 30 seconds. Problems with small dogs like this?
Yeah,
this kneecaps, right?
This particular breed of dog very commonly has luxated patellas, which is kneecaps that are out of joint. And this is something that if you're a breeder, you try to breed dogs that don't have this problem, because it's usually not corrected by surgery. That's the only way to treat it if the dog has it. And what happens is that they'll have crooked legs, and the kneecaps will go in and out of place, and it can cause lameness. So if you're going to get a little dog like this, make sure that the mother and father don't have kneecap problems.
Breed it out of the dogs.
Right.
All right. Well, veterinarian David Graff, thanks for coming today. You can go back to Mom now. All right, and coming up tomorrow here on TV9, psychologist Dick Sockwell. Stay with us.